good morning. Today I am going to discuss a special topic, hypertension in the young. It was an ordinary evening. A 24-year-old young man was sitting with his friends, laughing, checking his phone, talking about work, future plans, maybe even a trip he wanted to take. Nothing unusual, nothing alarming, and then suddenly he pressed his head, a severe bursting headache. Within minutes, nausea, repeated vomiting, dizziness. He tried to stand, but he could not, and then he collapsed. By the time he was taken to a nearby hospital, he was unconscious. His friends kept calling his name, but he did not respond. He was rushed for an urgent CT scan. Those few minutes felt endless, and then the report came, a large intracerebral hemorrhage, a massive bleed inside his brain. No accident, no fall, no poisoning, no known illness, only one silent cause, severely uncontrolled high blood pressure. 24 years old. At that age, life is supposed to be beginning, not breaking. And the most painful part, he never knew he had hypertension. This is no longer a rare story. This is becoming a pattern. Across India today, a quiet but dangerous shift is happening. More than 1 in 10 individuals between 15 and 49 years are already hypertensive. Among people under 40, awareness is low, diagnosis is delayed, treatment often starts late, and control is poor. Hypertension is no longer limited to the elderly. It is now seen in college students, IT professionals, corporate workers, gym-going young men, and even school-going adolescents. Recent Indian data has shown that over 80% of overweight adolescents already carry biochemical markers of future cardiovascular disease. Even children as young as 5 to 10 years are showing abnormal lipid profiles and metabolic changes. And our environment is not helping. Long-term exposure to air pollution has been shown to increase blood pressure also. It damages blood vessels and accelerates inflammation. And one of the most powerful long-term observations in medicine tells us this. If blood pressure is elevated at 18 years of age, the risk of heart attack or stroke in middle age rises significantly. So what appears as a sudden heart attack at 45 often begins silently at 25. What is really happening inside the body? High blood pressure is not just a number on a machine. It is a chronic mechanical stress on every organ in the body. The heart responds by becoming thick and stiff. The arteries lose their elasticity and become rigid. The delicate blood vessels in the brain become fragile and prone to rupture. The kidneys slowly lose their filtering units, and because all this damage happens silently, young individuals feel completely normal until one day something catastrophic happens. When we look at young adults today, certain patterns become very clear. Long working hours, constant mental stress, screen exposure late into the night, poor sleep, high salt fast food, processed snacks, low physical activity, weight gain, smoking, alcohol, energy drinks, supplements, sometimes even anabolic steroids. All these factors activate two powerful systems in the body. The sympathetic nervous system, the body's stress response, and the renin-angiotensin-aldosterone system, the body's salt and fluid control system. These systems increase heart rate, increase vascular resistance, retain sodium and water, and gradually push blood pressure higher. Slowly, silently, year after year, the pressure rises. The most dangerous part, no warning. The most dangerous truth about hypertension in the young is this. It usually causes no symptoms, no pain, no obvious sign. Maybe occasional headache, maybe fatigue, maybe nothing at all. And so the disease continues silently until it presents as stroke, heart attack, kidney failure, or sudden death. That's why it is called the silent killer. Now the diagnosis. The moment we can change the story. Everything changes the moment hypertension is detected early. How to measure blood pressure correctly? The person should sit quietly in a calm environment with back supported, feet flat on the floor, arm at the heart level after resting for at least 5 minutes. There should be no talking, no mobile phone, no distractions. At least 2 readings should be taken, separated by 30 to 60 seconds. And this should be repeated on different days. On the first visit, BP must be measured in both arms. Because even small errors like crossing legs, unsupported arm, or talking can increase BP by 10 to 20 millimeter of mercury. If readings remain high, we confirm it with home monitoring or 24-hour monitoring. Because sometimes blood pressure is high only in the clinic. It is called white coat hypertension. And sometimes it looks normal in the clinic but high at home. It is called masked hypertension. One high reading is not enough. It must be confirmed with home blood pressure monitoring or 24-hour ambulatory blood pressure monitoring. This helps detect white coat hypertension, masked hypertension, and nighttime BP patterns. Understanding the levels, simple classification. Blood pressure can be understood in four simple ranges. Below 120/80, that means healthy. 120 to 129 systolic, that means early warning stage. 130 to 139 systolic or 80 to 89 diastolic, that means stage 1 hypertension. And 140/90 or more, that means definite hypertension needing treatment. In young adults, sometimes only the lower number is high. It is called isolated diastolic hypertension. Sometimes only the upper number is high. It is called isolated systolic hypertension. Both matter, both need attention. Looking for silent organ damage. Even when a young person feels completely normal, we must check the heart, kidneys, eyes, and metabolic profile because silent damage may already be present. In young individuals, up to 15 to 30% may have a reversible cause, such as kidney disease, hormonal disorders, sleep apnea, or certain medications. Identifying these can sometimes cure hypertension completely. Now the treatment part, protecting the next 40 years. When hypertension is treated in a young adult, we are protecting decades of life. Lifestyle modifications, the foundation. Salt intake should be reduced to less than 5 grams per day, about 1 teaspoon total from all foods. Avoid processed foods, packaged snacks, and excess pickles. Eat more fruits, vegetables, whole grains, pulses, and low-fat dairy. Maintain healthy body weight, BMI between 18.5 and 24.9. Waist circumference below 90 cm in male and 80 cm in female. Exercise regularly, at least 150 minutes per week of moderate activity. Sleep 7 to 8 hours daily. Manage stress with yoga, meditation, or breathing exercises. Stop tobacco completely. Limit alcohol intake. When lifestyle is not enough, medicines are added. These include ACE inhibitors, ARBs like telmisartan, calcium channel blockers, thiazide diuretics, sometimes beta blockers in young individuals with stress-related hypertension. Often combination therapy is needed. The target is clear: blood pressure below 130/80 mm of mercury. Now the prevention part, where we change the future. Hypertension is one of the few major diseases that is preventable, detectable, and treatable. Every adult above 18 years should check BP at least once a year. Family members of hypertensive patients should be screened. Healthy diet, regular exercise, less salt, good sleep, stress control. These are not small habits. They are life-saving decisions. That 24-year-old young man, his life changed in one moment, but the disease that caused it had been growing silently for years. If it had been detected earlier, if it had been controlled earlier, this story could have been very different. Hypertension in the young is silent, but its consequences are loud. It is also one of the most preventable and treatable conditions in the medicine. To every young individual watching, please check your blood pressure regularly, respect your health, act early, encourage your family and friends to check theirs, and to my fellow clinicians, let us not underestimate hypertension in the young, because early action today prevents irreversible disease tomorrow. Thank you for joining me on Clinical Horizon. If you found this lecture valuable, please like, share, and subscribe. I will see you in the next session. Thank you.